Hi, this is Dr. David Tener. We're here at the Goldberg Tener Clinic where we specialize in reversing chronic disease. And today we're joined by Ms. Houston Harris, who's local from Atlanta. And she came to see us last year, back in 2022. We're now in August of 2023. And she has done very well under our care. She's worked hard and has made great progress. We've got some new lab work today that we'll show you in terms of some of the improvements that she's had. And she's going to share a little bit about her story with us. So Houston, tell us a little bit about what originally brought you in. What were your primary concerns?
When I came in, my asthma symptoms were way worse. I was having a lot of troubles. I was needing a lot of more medications and needing to use my rescue inhaler a lot. I was also having trouble with skin issues, with like rashes and hives, and I was losing my hair.
Okay, yes, and as part of that, you were also having digestive issues too, right? Okay.
Yes.
Yeah, so one of the things we explained to Houston when she came in was that we commonly see patients that have allergies and asthma and also have problems with blood sugar imbalance and with digestive issues. Those things tend to go together. And so as part of evaluating her, we looked very closely at her blood sugar and her digestive function. And in doing so, we found that her blood sugar was in fact elevated. She had a hemoglobin A1C that put her in a pre-diabetic range. And we also had run a glucose tolerance test on her, which showed that her blood sugar was not in good balance and that it was dropping pretty rapidly after she would eat. And when blood sugar is not well balanced, allergies tend to increase. And digestive problems, we also checked you for that too. We looked at how you digest food, proteins, carbohydrates. We found some problems there also. And when digestion's not good, allergies and asthma also tend to get worse. Right? So we found that those things tend to go together. So in working with Houston, we developed a program for her and to address those factors and start the process of rehabilitating her health. And over the course of the last year, you went through some ups and downs, but overall, we've made some great progress. What kind of changes have you noticed in those areas?
I think once we realized what my new allergies that I developed were and cut those items out, my joint pain, my hair started growing back, my digestion improved immediately. I think also my energy was a lot higher really soon.
Yeah, and you had not just food allergies, but you had a lot of inhalant allergies. I remember your test result kind of lit up like a Christmas tree
Yes.
in terms of all the things that were highlighted on there. And so we had both inhalant allergies and food allergies. And when the right steps were taken to calm that immune system down, which in your case was primarily get your blood sugar in better balance and get your digestive issues improved, we saw those allergic tendencies drop. So you haven't needed to use your rescue inhaler, and you made it through pollen season this year. And we live in Georgia. Pollen is very high here. You can see it, in the air. It gets all over your car. And what kind of problems would you have during pollen season in the past? What was that like for you?
It's very typical for me to get bronchitis, a lung infection, need to get on a lot of steroids to help with my asthma, getting more asthma medications to help prevent my symptoms or decrease them, and I haven't needed at least half of those. I didn't get any lung infections this year, didn't need any steroids at all. Things are a lot easier. Wonderful.
Yeah, so we're thrilled with the improvements. She's reported about a 70% overall improvement so far. We're going to see if we can get her all the way up to 100% as close as we can, but we certainly come a long way. We got some new lab work today. Both of her inflammatory markers, her CRP and her sedimentation rate, look great. Her A1C, which was in the pre-diabetic range before, is well away from that now, came back at 5.1, which is very healthy and normal. Fasting insulin is nice and low, C-peptide levels are low, and her insulin resistance panel, which we run through a lab here in Georgia, put her in showed her to be in a state of insulin sensitivity, which is where we want to be. So we have subjective feedback from Houston that she's doing much better, and we also have the objective findings to show that as well. So all in all, we're on the right track. Appreciate you sharing your story and your experience with us. It's certainly been a pleasure to work with Houston. I got to give her some credit too. We gave her the right advice, but she had to go home and make use of it and be consistent and disciplined, and that always makes for an increased potential for success.
Yes.
So thank you very much.
Thank you all for all the help.